Hi everyone, thank you for joining me. On October 27th of this year, CMS issued calendar year 2021 proposed rule for durable medical equipment, prosthetics, orthotics, and supplies policy issues and healthcare common procedure coding system level 2. Some of the key points of the proposed rule CMS 1738 PR: changes to the DMEPOS fee schedule adjustments. The purpose of this proposal is to establish the methodologies for adjusting the fee schedule payment amounts for DMEPOS items furnished in non-competitive bidding areas on or after April 1st, 2021, or the date immediately following the duration of the public health emergency for COVID-19. Under this proposal, CMS would continue paying suppliers higher rates for furnishing items and services in rural and non-contiguous areas. The agency proposed this rule after receiving input from stakeholders indicating higher costs in these areas, greater travel distances, the unique logistical challenges, significantly lower volume of items furnished in these areas, etc. Changes to the classification and payment for continuous glucose monitors under Part B. Currently, CMS covers only therapeutic continuous glucose monitors or those approved by the FDA for use in making diabetes treatment decisions like changing one's diet or insulin dosage based solely on the readings of the continuous glucose monitors. This rule proposes to classify all continuous glucose monitors as DME and establish payment rates for supplies and accessories used with CGMs. This rule will enable monitors that are not approved for use in making diabetes treatment decisions to be used to alert beneficiaries about potentially dangerous glucose levels while they sleep and further test their glucose levels with a blood glucose monitor. With this proposal, Medicare beneficiaries and their physicians would have a wider range of technology and devices to choose from in managing diabetes. This proposal will improve access to these medical technologies and empower patients to make the best healthcare decisions for themselves. Expanded classification of external infusion pumps as DME. The purpose of this proposed rule is to revise CMS's interpretation of the appropriate for use in the home requirement for certain external infusion pumps. CMS is proposing that an external infusion pump would be considered appropriate for use in the home if, number one, the Food and Drug Administration required labeling requires the associated home infusion drug to be prepared immediately prior to administration or administered by a healthcare professional, or both. Number two, a qualified home infusion therapy supplier administers the drug or biological in a safe and effective manner in the patient's home. And number three, the FDA required labeling specifies infusion via an external infusion pump as a route of administration at least once per month for the drug. In addition, drugs or biologicals administered through an external infusion pump that is an item of DME can be covered under the Medicare Part B benefit for DME as supplies necessary for the effective use of the external infusion pump. Under CMS's proposal, if an individual or caregiver is unable to safely and effectively administer certain infusion drugs, such drugs could be covered as supplies necessary for the effective use of an external infusion pump under the DME benefit if the criteria listed previously is satisfied and presumably the external infusion pump satisfies all other relevant statutory and regulatory requirements for DME. Proposals related to the Healthcare Common Procedure Coding System (HCPCS Level II code application process). CMS is proposing to codify certain policies and procedures regarding the submission and evaluation of HCPCS Level II code applications for products paid separately as drugs or biologicals and non-drug, non-biological items and services as defined in the proposed rule. CMS is proposing to codify the more frequent coding cycles as implemented January 1, 2020, including timeframes for application submission and final decisions, and to update associated policies and processes. The proposal also includes processes that CMS would use to evaluate HCPCS Level II code applications, to add a code, revise an existing code, or discontinue an existing code. Exclusion of complex rehabilitative manual wheelchairs and certain other manual wheelchairs from the DMEPOS competitive bidding program. This rule proposes to revise the definition of item under the competitive bidding program at Title 42 Code of Federal Regulation 414.402 to exclude complex rehabilitative manual wheelchairs and certain other manual wheelchairs and related accessories. Here I have pasted references to the material that was used to create the content of this presentation. If you enjoyed this video, please subscribe to my channel. Thank you for watching. Hope to see you soon.